everyone, I am Dr. Issa, your OBGYN on call, and in this video series, I provide guidance on a wide range of sexual health topics ranging from contraceptives to menstrual-related issues, among others. For this episode, I will be discussing a highly requested topic, which is what to expect and how to prepare for your first gynecologic visit. If visiting an OBGYN makes you feel a bit nervous, don't worry, you are not alone. It's entirely normal to feel a bit apprehensive about it, to feel a bit anxious, but don't worry, I will guide you through the process to help you feel more at ease. Let's begin this guide by explaining what it means to be an OBGYN, coming from someone who is an OBGYN herself. OBGYN stands for Obstetrics and Gynecology, so we have extensive training in both obstetrics and gynecology, specializing in the comprehensive care of the female reproductive health. Now, there's a misconception that OBGYNs only deal with pregnancy and childbirth. However, this is not the case. So these are very vital components of our expertise. However, our scope as an OBGYN goes far beyond the delivery room. Aside from cesarean sections and instrumental deliveries during childbirth, we OBGYNs also do surgical procedures like hysterectomies, removal of growths like ovarian cysts and myomas, and repairing pelvic organ injuries. In addition to surgical procedures, OBGYNs like myself also handle routine and in-office procedures. These include procedures like doing pap smears for cervical cancer screening. We do also biopsies for suspicious lesions in the female reproductive tract, and we even request for STI testing as well. Beyond the general roles, OBGYNs can even specialize further. There are OBGYNs who subspecialize in maternal fetal medicine or perinatology, and they handle high-risk pregnancies. Reproductive endocrinology and infertility specialists specialize in those cases of infertility. They also do fertility treatments like egg freezing, intrauterine insemination, in vitro fertilization as well. And they are also the ones who are trained to do minimally invasive surgeries like hysteroscopy and laparoscopy. OBGYN sonologists focus on ultrasonography that focus on the pelvic organs. Urogynecologists handle issues of the pelvic floor. They also do surgeries on pelvic organ prolapse. They also handle urinary issues like incontinence. Gynecologic oncologists focus on treating patients with reproductive tract cancers like cancers of the vulva, vagina, the cervix, the ovaries, the uterus, or the endometrium. OBGYNs who subspecialize in trophoblastic diseases treat patients who have molar pregnancies and gestational trophoblastic diseases. We also have OBGYNs who subspecialize in family planning, sexual health, or pediatric gynecology. Now that you know what an OBGYN is, you might be wondering when is the right time to have your first gynecologic visit. Scheduling your first visit with an OBGYN is a positive step towards taking charge of your reproductive health, and you can do it at any age. Whether it's a routine checkup during the onset of menstruation and puberty, or addressing a specific gynecological concern later on, an OBGYN is always there to support you. If you are experiencing any reproductive issues like irregular menses, heavy bleeding, unusual vaginal discharge, vulvar itching, or even problems with getting pregnant, it is essential to reach out to an OBGYN. Our expertise is not limited to a specific age group, and we are here to provide guidance and care that are tailored to your individual needs. If you are under 18 years old, it's important to have your parents or your guardians with you. Their presence will ensure that you have the necessary support and guidance, and it can also facilitate an open communication with your healthcare provider. As for people who are already in their late 20s to early 30s and have not yet had their first gynecologic visit, don't let that worry you. It's never too late to prioritize your health and well-being, and of course, every health journey is different. Our commitment is to provide a thorough checkup and of course to address any concerns that you may have regardless of when you decide to take this very important step. Okay, let's move on to finding a trusted OBGYN. The process may seem tedious, it might be a trial and error for some. However, with some strategic steps, you'll be on your way to finding the perfect healthcare partner for you. Number 1 is recommendations. You can start by reaching out to those people whom you trust the most, your friends, your family, your relatives, and even your primary care physician. Personal recommendations can offer valuable insights into the expertise and overall experience with a particular OB/GYN. This can also help you determine whether a doctor aligns with your preferences and your values as well. Number 2, check with your health insurance provider for in-network options. Insurance referrals not only ensure financial compatibility but also streamline the administrative process. This is a great option for those who are on a tight budget because your insurance can already cover the costs for the basic checkups and other procedures. Number 3 is researching through the internet. You can take advantage of platforms and online directories. These online platforms often provide patient reviews, and these can provide very valuable insight on the overall patient experience, the patient wait times, and how the clinic effectively communicates with their patients. Last but certainly not least, you can check out the clinics within your area. Whether it's proximity to your home, workplace, or easy public transportation access, choosing a clinic that fits seamlessly into your routine can make regular appointments more stress-free and manageable. So let's say that you found an OB/GYN and you already scheduled your first checkup. That's great! So now let's discuss what are the different things that you can do to prepare for this particular visit. Number 1 is medical history. Bring any relevant medical history, your maintenance medications, if you have any chronic conditions, asthma, allergies, and even your surgical history. We will also ask you about your family history, your social history, your menstrual history, your sexual history, and obstetric history. Number 2 is knowing your menstrual calendar. This can provide essential information about your reproductive health. We usually ask for the first day of your last or your current menses. We also ask at what age did you have your first menses. We ask how regular or irregular it is. We ask how many days it usually lasts, how many pads that you use per day, or if you use tampons or menstrual cups as well. And we also ask if you have any symptoms like dysmenorrhea. These details are needed when assessing certain issues. Number 3 is a list of your current medications, including contraceptives and supplements. By providing a thorough list, you're giving your OB/GYN insight on the ongoing treatments, possible interactions, and even underlying health conditions. Number 4 is a list of questions for your doctor. You can jot down any questions or concerns that you have so that you won't forget them. It's so easy to forget your concerns, especially when you're in front of the doctor, so having a list can make sure that everything is addressed. Number 5 is IDs and filled out forms. These forms might seem like they're just another piece of paperwork, however, they're designed to collect information like your health history and your contact details. Filling them out in advance saves time, and it also allows your doctor to dive straight into your concerns. Now, let me walk you through what you can expect during your first gynecologic visit. Understanding what to expect can help you feel more comfortable knowing what's going to happen during that visit. The first step in the process is the initial discussion with your doctor. Your OB/GYN wants to get to know you beyond your medical history. This is also the chance to be able to address your concerns, your questions, and even your preferences. Your doctor's office is a safe space, and you can talk about the following: menstrual-related issues, sex and sexuality, birth control options, sexually transmitted infections, and even prenatal concerns or pregnancy concerns. After the initial discussion of your history with your doctor, we will now proceed with the next step of the process, which is a routine physical examination. This series of tests help to assess your overall physical well-being and reproductive health. The examinations that I'll be discussing at this part may not all be part of your general checkup with your doctor, and it can vary with your concerns and your comfort level. The first part is the general physical examination. Your OB/GYN will take your vital signs, so that's your blood pressure, your heart rate, respiratory rate, and even your temperature and oxygen saturation levels. We will also assess you systematically. So we will look at your head, your neck, your skin, and then your chest, your lungs, your heart, your abdomen, and even your extremities as well. It's a holistic way to ensure that there are no other immediate concerns in other areas of your body. After your general physical exam, we will now ask you if you will be comfortable with doing a pelvic exam. If you are comfortable in doing so, then we will now lead you to the examination bed, where you will remove your underwear and lie down in a dorsal lithotomy position. So first, we will do the external genital exam. We will look at the mons pubis, the clitoris, the labia majora and labia minora, and even the perineal body. So basically, everything that's seen over here outside, we will be assessing that first. Sometimes your OB/GYN can also ask you if you will consent to an internal examination, especially for specific gynecologic concerns. The pelvic exam involves a more thorough assessment of the internal reproductive organs like the cervix, the uterus, the ovaries. So first, we do a speculum exam to view the vaginal walls and the cervix. With the help of a speculum, we are able to see the vaginal walls and the cervix. We can also see abnormal discharge and bleeding, if any. After the speculum exam, we may also do an internal examination. So usually what we will do is to insert our fingers into your vagina and palpate any lesions in the vagina or the cervix. After this, we will also be doing the bimanual examination where we will put our other hand onto your lower abdomen and palpate for the uterus and the ovaries as well. For individuals 25 years and above, a pap smear may also be part of the agenda. This test is designed to detect any abnormal cells in your cervix. Precancerous cells in the cervix can be detected by the pap smear, so it's so important to have this done every 3 years. We offer to do the pap smear during the speculum exam so that the patient only has to go through this once. If you are sexually active, your OB/GYN may also suggest tests for sexually transmitted infections or STIs. This can help provide early detection, timely intervention, and treatment. To further confirm the diagnosis that we made in the clinic, especially if we are considering a pathology in the internal organs, we usually request for a pelvic ultrasound, preferably done by an OB/GYN sonologist. Now, this is just a rundown of all of the routine tests that can be done in the clinic. There's so much more to learn about these exams, but I will leave it to your OB/GYN to explain it further to you. I highly recommend engaging in a conversation with your doctor beforehand, especially if you want to understand what tests you're going to go through. And that ends the process of your first gynecologic visit. The next steps will now depend on what your OB/GYN has discovered from your initial consultation and routine tests. You might find yourself in a path of medications, maybe a few more lab tests, or simply leave the clinic healthy. After learning about what to expect during your first gynecologic visit, here are some tips to further enhance your experience. Number 1, choose comfortable clothing. You might need to quickly change in and out of an examination gown or just have more suitable clothing for certain tests. So think about clothing that's not only comfortable for you, but also something that's easy to slip in and out of. 2, schedule wisely and arrive early. Time is precious and we want your appointment to be stress-free. Schedule your visit thoughtfully and consider when you're most relaxed. You can come in even when you have your menstruation or if you are bleeding, especially if that is your concern. We are trained to see you even during your red days. Number 3, prepare your questions, concerns, and some topics that you want to discuss with us. This can ensure a well-rounded and efficient conversation with your doctor. Number 4, be honest with your doctor. Your OB/GYN is here to support you, and being transparent about your medical history, concerns, and inquiries can help us tailor care to your unique needs. Number 5, consider bringing a trusted friend, your partner, or family member if it adds to your comfort. Sometimes having that familiar face around can help add an extra layer of support. And that concludes the ins and outs of your first gynecologic visit. I hope that this video has eased any concerns and helped shed light on what to expect during your visit. If you found this information helpful, please click the like button, and if you haven't already, please subscribe for more sexual health related content. By subscribing, not only do you stay informed, but you also contribute to help break down the different taboos surrounding sexual health. Once again, this is Dr. Issa, your OB/GYN on call. See you in the next episode.